So yesterday I was having an interaction with a patient. This is a man that should be within, I think, around the age of 50 years up above, right? And he told me how he no longer feels himself if he does not take a particular drug. Like, he's just weak, he can no longer do anything, and he feels this kind of little kind of depression all over him if he does not take these particular drugs for some time now. And I inquired to know about the drug, and he mentioned a certain opioid analgesic, tramadol hydrochloride. And I began to inquire, how come about the drug? Like, how did you start taking the drug? And he told me that he's diabetic, and he, at a certain time, like some years ago, like 2 years ago, he went to meet a certain drug vendor, and who told him and complained to him that he can no longer work as a man, or physically, or perform his duties as a man, that he feels this internal weakness all over him and loss of strength. And fortunately or unfortunately for him, I don't know what to say, the drug vendor told him that he himself is going through same thing, and there is a drug he has been using to sustain himself, both for physical duties and also to perform as a man, that he takes this drug on daily basis. And he told him that the drug has been helping him, and he can also use the drug as well, and that is how he started taking the drug. Now I want to use this video to address some issues in the intake of medicines among patients. Now, first of all, this man is diabetic. In the first place, there is no business with diabetes or high sugar level with an opioid analgesic. What are opioid analgesic? Opioid analgesic are majorly used for pain. So in the first place, that was a wrong prescription by the drug vendor. Right now, let me actually advise us a bit. Now, medicines is not something that you take or you prescribe for someone because they prescribe it for you or because it works for you. Before your pharmacist or your doctor prescribes a certain medications for you, they must have known the underlying cause of your illness. Now, that is first thing. So don't give drugs to someone because the person is feeling the same thing that you are feeling, and you feel is the same thing that the person should take the same drug. That one is one. Now, the second thing I want to address, point 2, is the fact that in treatment, you don't treat symptoms, you treat the cause of the illness. Now, let's say, for example, this man is having diabetes. Now, someone that is diabetic end up becoming immunocompromised. What do I mean? It means that your immune system drops if you are diabetic. The way you respond to sickness drops. So now, given that weakness or that loss of strength might be due to the diabetics that the person is having, but giving a medication to treat the symptoms is not the ideal course of treatment. What you are supposed to be treating is the cause of the symptoms, not the symptoms itself. Sometimes you may come up with symptoms like feverish condition, headache, and you just take something for headache and it does not go. Sometimes probably it's malaria. Until you treat malaria, that symptom does not go. That's what you know, that medical practice, you don't treat symptoms, you treat the sickness. The last thing I want to address here that actually happened here is addiction and drug dependence. Now, the reason why you are advised not to take drugs on a continuous basis, or some certain drugs on a regular basis, or when you are asked to say you should consult a pharmacist before taking a drug, is for the sake of addiction or drug dependence. Addiction is when you become addicted to a certain substance, not just drug or alcohol or any substance at all, that you can no longer do without it. Your body does no longer function properly without these drugs. Now, let me address the issue of opioid analgesic. Now, this particular opioid analgesic that I'm talking about, it's a serotonin and non-epinephrine reuptake inhibitor. Now, a pharmacist will understand these words that I just mentioned, but let me break it down. What we mean that something is first of all, let's talk about serotonin or epinephrine. Serotonin and epinephrine are neurotransmitters that are responsible for the way your body reacts to things, your functioning, and to an extent happiness or alertness. Okay, let me use the word alertness. Now, when your body produces certain number of serotonin in your body, and it takes it back, it does not waste it. That is a process we call reuptake. It takes it back to where it is being produced. Now, what this drug does is that it inhibits the reuptake of serotonin and epinephrine, and at this point you are having much more number of serotonin and epinephrine in your body. Let's talk about the effect of using a drug or any substance to increase the amount of serotonin or norepinephrine or dopamine in your body system. Now your body has the number that it releases and it uses. So when you your body releases more than enough, or you trigger it by the substance more than the number that your body releases or your body stores or keeps in your body at a particular time, it keeps you so much at alert, and this functions for a very short time, a very short limited time. Now your body is now getting used to this. Now by the time you do this more often or more regularly, your body is needing more serotonin or epinephrine or dopamine in your body, these neurotransmitters in your body, than what it can produce. So it gets to a point that for you to be able to keep yourself alert, you must meet up to this number of neurotransmitter that you are triggering to produce, because your body cannot produce them on its own. So it gets to a point that, you know, these are substances, these are neurotransmitters that keeps you at alert. So it gets to a point where you can no longer maintain the level of these neurotransmitters in your body. Your body have already adapted to it. Your body is no longer alert or lively, or you cannot function physically the way you should be, because you have taken your body to a limit that your body cannot produce. So you'll be needing to trigger these substances more regularly by a substance. That's the reason why people that take all these drugs tend to be more active, they tend to be happier, they tend to be more at alert. But immediately they spend a day without taking these substances, you become depressed and you can no longer function properly. So some of these things that you take is only helping you for a short period of time because they are short acting, and you just need to keep topping them to upgrade them. This is how it is for anybody that is substance dependent, irrespective of the substance involved. It can be smoke, it can be alcohol, it can be drug, or it can be anything. So substance abuse is totally wrong when you abuse some certain drugs. The reason is because these are some of the drugs that crosses your blood-brain barrier and gets to your brain. So what you need to do is that you should limit the way you talk substances more regularly. So I've addressed 3 things from this video. One is the fact that don't prescribe a drug for someone because they prescribed it for you, it worked for you, and the person is having the same symptoms that you were feeling. 2 is the fact that in medical treatment, you don't treat symptoms, you treat the cause of that symptom. And the 3rd thing is that don't abuse any substance. Anything that you take that gives you 3 minutes or short time pleasure is killing you unknowingly. I hope this video has been helpful, and I will make more videos to address a lot other issues in the health factor or issues with the use of drug. I remain your one and only Dr. Best. Make sure you follow me on all social media platforms, and if there's anything you want me to talk about or you want me to address, just drop it on the comment section of this video. Thank you and God bless you. See you in the next one. Bye.